Hi, my name is Dr. David Blum. I'm an orthopedic surgeon. I specialized in hand and upper extremity surgery. I practice at Orthopedic Center of South Florida. We have multiple offices. I work mostly out of the Plantation, Florida office. I also go to the Delray Beach, Florida office. I am an orthopedic surgeon, which means I specialize in problems with the musculoskeletal system, problems with bones, tendons, muscles, and the like. And within that specialty, I specifically treat elbow, wrist, and hand problems. I've been doing this for over 20 years. I had more than 7 years of training in orthopedics and hand surgery, as well as research. Prior to that, I went to medical school for 4 years, and prior to that, I went to college for 4 years. So it's a long road to get to where I am today. But I enjoy what I do, and I'm happy that this is a specialty that I chose. Well, it depends on the day. Some days I'm in the office and I see patients. I will see patients in the morning from 8:30 till about noon. If I'm lucky, I get a lunch breaks from 12 to 1, but usually it ends up being more like 12:40 to 1. And then we start up with patients again at 1 o'clock, and I usually finish sometime around 5:30 or 6. Some days I go to the operating room. On certain days I'll operate all day, and then when I'm done with the operations I go home, and on other days I'll operate in the morning, and then I'll see patients in the afternoon. Well, first of all, a patient can expect that they're going to get great care and that they will get my undivided attention, and that I really care about all of my patients and that I want them all to do well. So it depends on what their problems are, how we approach it. Some people need surgery, but quite frankly, even though I'm called a surgeon, more patients than not that I treat don't require surgery. So we do plenty of non-operative treatments such as therapy, medications, injections, and there are certain office-based procedures such as ultrasound-guided trigger finger release, which I can do in my office and actually do a surgery in my office. The most gratifying part of my job is the fact that I've been able to treat so many patients for so many years in the same community. I've been practicing in Plantation for 20 years now. I've taken care of patients, I've taken care of parents of patients, children of patients. I've taken care of people when they were kids and they've come back to see me when they're adults. So I feel that even though I don't do primary care, which routinely treats patients all the time, I have a lot of return patients. So I've gotten to know a lot of patients, and they tell their friends and their family members who come to see me, and it's just a nice experience being able to help people fix the problem that they have in most cases and have them go on their way. And then if they have another problem, they'll come back and see me or send their family member to take care of. But I'd say that's probably the most gratifying part of what I do.